So we have here a couple that is planning to do a missionary work that is going to a country where malaria is prevalent. Their estimated stay in the country is 2 to 3 years, and the physician has prescribed hydroxychloroquine or Plaquenil that needs to be taken weekly. So we have here the case facts that the couple are indeed going to a country where malaria is prevalent. They're planning to stay there for 2 to 3 years, and the physician has prescribed hydroxychloroquine or Plaquenil that needs to be taken weekly. So first we need to know that what's the definition of malaria? Well, malaria is an infectious disease that can cause death if not treated right away. It is transmitted by the bites of a female Anopheles mosquito. So we need to assess those patients or the couple where they're planning to go. Just in this case, we're going to say that, for example, going to India. Since India is considered as a prevalent country that is accounted for malaria, in which case it contributes 6% of malaria cases in the world. We need to know the detailed itinerary of the couple since their missionary work is very active, so we need to know what kind of activities they do within the day. And we also need to know what type of accommodation they are planning to do, if they're going to a hotel or just camp out at night. And we also need to know their medication history, because there are some drugs that can cause or could have an interaction or reaction with Plaquenil. As precautions, we can see here, they need to be alert because even if you have the protection that you needed, you are still at risk for malaria. They also need to apply insect repellent to their exposed skin. They need to wear long sleeve clothing and long pants. And they need to use mosquito net over their beds, depends on their accommodation. Mosquitoes can still bite through thin clothing, so I suggest that they should wear clothes that are a bit thicker. We now move on to Plaquenil. What is hydroxychloroquine or Plaquenil? It is an arthritis disease that can also be used to treat malaria. So the Plaquenil needs to be taken once a week. And I suggest for the couple to start taking their medicines 1 or 2 weeks before they travel. And if they forget to take their medicine, it is okay because you can just skip it and just move on to the next scheduled dose of taking your medicine. But you should never double dose. I advise the couple to buy their medicine where they receive the doctor's order before they travel, because there could be a possibility that they could encounter in India that they could buy counterfeit drugs or fake. These are drugs that may not be effective, therefore it could have a different result than what you expected. 3 to 4 bottles should be enough for the both of them since it is taken only once a week. 1 bottle of the Plaquenil should have 100 tablets to look out for the counterfeit drugs. So this is an image of the Plaquenil. You need to compare your bottle to the ones you're going to buy in India. And we also need to buy it from a trusted pharmacy. There are also side effects when taking your Plaquenil. Hydroxychloroquine is a relatively well-tolerated medicine, and the most common adverse effects are here the stomach, pain, nausea, vomiting, and headache. These side effects can often be lessened by taking the drug with food, so it is suggested that before you take your Plaquenil, you should eat first. But if you cannot tolerate these effects and you're having different reactions with the drug, you should just seek the medical healthcare provider.